In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Afternoon, everyone, and welcome to another edition of In Full Zoom. I'm Nestor Licanto, and this week we're going to talk about some groundbreaking research on diabetes that will be conducted soon. And of course, as you all know, the disease has a very high incidence rate here on Guam, particularly among Chamorros and Filipinos. And let me introduce our guest this morning, or today, Dr. David Klonoff of the AI Health Medical Advisory Board, and Dr. Erika Alford here in Guam. She's an endocrinologist with AMC, and she will be the local principal investigator of the study. Welcome to the show, guys.
Thank you. Good morning, Lester.
All right, sorry, technical issues here, but okay, there you go. So first of all, let me just set the table and I'll read from the announcement, and then I'll ask Dr. Klonoff to begin the discussion. So the Guam Regional Medical City, American Medical Center, and Calvo Select Care have joined forces with AI Health to launch a research partnership to bring cutting-edge artificial intelligence medical research to our island. The planned study will focus on aggregating healthcare data from different sources and applying AI to identify critical risk factors and provide insights into treating patients with diabetes. Dr. Klonoff, tell us a little bit more about this study.
Yes, well, I'm an endocrinologist in California, and I'm interested in technology, and that's why I joined up with the AI Health organization. Right now, one of the big movements in medicine is called precision medicine. If it's for diabetes, it's called precision diabetes. What that means is that you gather as much specific information as you can about a patient. And some of this information comes from sensors that people wear. Some of it comes from lab tests, and some come from other kinds of observations that you can make using digital data. And when you have all this data for a patient, you can see what types of treatments work best for that patient. So this approach, which AI Health is using in conjunction with the Guam organizations that you mentioned, is intended to see patterns of data. And when we understand the patterns of the folks in Guam, this information can be used in many beneficial ways. When you have data, you can use that to make a diagnosis. You can use that to select the best treatment. You can use that to create a prognosis, what's likely to happen. And you can use that information for prevention. So all those four factors, diagnosis, treatment, prognosis, and prevention, all stem from monitoring data and then analyzing the data and using it to help the patient. And this project with Guam, I think, has a lot of potential because the population in Guam is pretty well organized. Fortunately, Dr. Alford is seeing many of these patients, and it's possible to take this information and apply it to a large number of people that are in the same place. In this case, that place is Guam.
Dr. Alford, you will be, of course, the local principal investigator. Tell us a little bit about what that role entails.
So I'm very excited about this. When Frank Campillo approached me initially, and AI Health approached me, because I think this will really help the people of Guam and at some point the people all over the world. My role in this is to be the boots on the ground, understanding the local community, where the patients come from. As you know, I'm one of two endocrinologists in Guam treating diabetes. And so I see a large number of these patients. And unfortunately for our local population, our diabetes patients have a lot of complications associated with their diabetes. And the goal is to prevent all these diabetic complications. And as much as we can, if they already have the complication, to prevent further worsening of these complications.
And Dr. Klonoff, if you could just expand on the role of artificial intelligence in medical research. Is it really a game changer, as it appears to be?
Yeah, artificial intelligence in some ways is a fancy word for using mathematical formulas, but you put together so many even simple formulas that it can become a bit much for any person to handle, and you use a computer to handle it. So you might say, for example, that a certain test is associated with a certain result. And then you say another test is associated with another result. And what if a person has both tests? Well, they have a certain association with both results. And when you put together a lot of different relationships, it gets complicated. And the name for the computer programming is artificial intelligence. But it's based on principles that anybody who knows even basic math can understand. What this project is going to do that I think is pretty groundbreaking is look at a large number of data streams. We're used to looking at blood glucose and making predictions about what kind of complications people might have and who needs the most prevention treatment. But there are many other factors, I believe, that also play a role. They may not be as important individually, but each one plays a role. And when you combine a lot of different factors together, you can come up with a very powerful prediction of what's going to happen. And then you know what to do about it. So there could be, for example, a certain factor that's maybe not as important as glucose, but it's still a factor. And you layer that in and you layer in other factors. And each piece of information you look at, it could even be something very simple. Could be how much exercise do you do? Do you eat a certain type of food that's associated with a poor outcome? Those are fairly obviously related to diabetes. Could be something like, do you have I don't know if this is the case, but it could be that if you have a certain hobby that involves just sitting down and not exercising, like watching TV shows or something like that, it might turn out that that is associated with complications. I don't know, but we're going to put together lab work, results from insurance claims, results from hospitalizations, information from the medical records, behavioral information that we can find, and look to see which of the factors that people do and how much of what they do are linked with certain types of outcomes. Now, when we know that, for this population, this study is not for people from Europe or South America or Africa, North America. This is for people in Guam. We'll be able to find relationships. The people who have these activities, these behaviors, these tests are, let's say, at risk of this. But we also know that people with this information who get this treatment have the best outcomes. So it's not just to look at somebody under a microscope and say, aha, you're going to have a problem, but it's to use the information to figure out the best treatment.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Yeah, fascinating. You take all this accumulated massive data, and you're able to sort through it and identify things that you might not just see on just a regular. And as an endocrinologist here on Guam, Dr. Alford, tell us a little bit how this information will help you.
I think it'll help tremendously. Guam, as you know, Nestor, is rather behind when it comes to technology and integrating technology into our daily lives. We just recently started using a lot of continuous glucose monitoring devices, which has really revolutionized the way I treat patients, and it has revolutionized the way patients live. This takes it 20 steps beyond, 100 steps beyond. And so I think when the study is done, I think we'll have a lot of good information that we can apply to our local population to help them control this horrible disease.
Yeah, and I understand that come next year, you're going to be launching a validation study. What exactly is that?
Well, the best way to reach a conclusion is to start with a group of patients and then see what happens to these patients if they have a certain treatment or a certain kind of behavior. But sometimes you don't know what to look for. So first you do what's called a retrospective study, which is what we're going to be doing. And you look and see what types of behaviors lead to what outcomes. Now, it could just be a coincidence that certain types of behaviors lead to certain outcomes. But what we say is that if we do a retrospective study and look and see what happened, it suggests the hypothesis that maybe this activity leads to this outcome. Could just be these people, but it could be everybody. So once you have a hypothesis, the next step is you test the hypothesis with what's called a prospective study. There, you You start with people, a different group of people at the very beginning of a time period, and you say, okay, now we're going to see which ones do this behavior, and of those, what is the outcome? And so you start with retrospective to come up with a hypothesis. What are we going to look for? And then you do a prospective to actually show what the relationships are. You can't be sure of the relationship if you just do retrospective.
Gotcha. And Dr. Alford, through the years, we've heard so many stories on Guam about why there is such a high incidence of diabetes here among Chamorros and Filipinos and others. And, we hear everything from, we eat too much white rice, it converts into sugar. And so that's the reason why, we have white rice, breakfast, lunch, dinner. Why is there such a high rate of diabetes here on Guam?
I think it's multifactorial. The first is the culture is completely centered around food, and any celebration, any tragedy, there's always food involved. We use it for comfort. We use it to show people we love them. And there is so much weight carried in the food arena here. So that's one thing. The types of foods we have is also another issue, because we have a lot of refined starches, a lot of processed foods, a lot of fatty meats as part of our diet. And we don't have as many fresh leafy greens and other fresh vegetables and fruits. Part of it is we only grow so much on island, and importation is very difficult, and the prices go up. And so eating healthy can be cost prohibitive for some people. And we also have very little activity. If you go anywhere else in the world on a daily basis, we do more activity if we travel anywhere else. And yet on Guam, just to go to your auntie's house 3 doors down, most people jump in their car for various reasons, right? It's hot. There's boonie dogs around. You don't want to get bitten. We have a million reasons why. It's raining. And so we always get in our car for even the shortest distance, and we don't walk there. And so the amount of activity is very different from the rest of the world. I think we have a lot of barriers here, but I don't think they're impossible to overcome. And I think it's just a public health awareness. And hopefully one of these days we'll do much better with diabetes in Guam.
Yeah, and Dr. Klonoff, and I'll ask you also, Dr. Alford, what do you hope will be the end result of this study?
Well, I'd like to see some new relationships established. Whenever you do research, you like to see something new. And I think we'll have an opportunity to gather so much data that it is possible that we'll discover that certain types of combinations of behavior or combinations of lab results or activities lead to, let's say, much higher risk. And then we know what to tell people to minimize the risk. Also, we might find that certain kind of people have better or worse outcomes with certain medicines, and then we'll be able to provide better advice. So I'm hoping we discover something from this study that's not known. And frankly, to my knowledge, there hasn't been a lot of research in diabetes in Guam. So it's possible that something will turn up that pertains to folks from Guam that's different from folks in other places. And if that's the case, then Dr. Alford and others on Guam will be able to apply that information to help their patients.
And before I ask Dr. Alford what she hopes the end result will be, let me also ask you, Dr. Klonoff, you mentioned, that there are a lot of different outcomes that could come out of this. But is it possible that also, I know that at this point, diabetes is not considered a curable disease, it's a treatable disease, but is there a cure possible out of all this data?
Well, there is a cure for type 2 diabetes. It requires people losing a lot of weight. And in many cases, it's more weight than somebody is going to do. They just cannot or will not lose that much weight. If the data shows that whoever did lose weight has much better outcomes, then that would maybe encourage other people to try that also. But in case we have people who aren't going to lose enough weight, which I think is going to be the majority of people, then we need to offer them something else. You can't just tell a person who's overweight, lose weight. I mean, if they're not going to lose the weight, it's not really useful advice. So we need other, whether they're medicines or other treatments or diets, whatever can be done to improve the person's health. So, I think some people can lose enough weight to cure their diabetes. It's unusual, and this study is not really intended as much for those folks. It's the people maybe that Dr. Alford was talking about who right now they're not eating healthy, or they're driving too much and walking too little. And whatever we can do, even to help those people, would be an improvement.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Yeah, and Dr. Alford, what do you hope will be the end result?
I am hoping that we improve diabetes care on Guam. That's the bottom line. I am sick and tired of seeing, very young people who are blind from diabetes, who are on dialysis from diabetes. I'm tired of seeing young people die from massive heart attacks associated with their diabetes. So I just want to improve the healthcare of the people of Guam, and whatever it takes, I'm willing to try.
I think that one more point I want to make. Dr. Alford mentioned that she's using continuous glucose monitoring. That's a huge step forward for any clinic or any place that's using it. That gives people really valuable information. And I think that glucose information, blood glucose is great, but continuous glucose is super great. And the more people who use that, the better the outcomes are going to be. And we'll show in our study what happens to people who do monitor themselves with continuous glucose monitoring, which ones don't. There's a lot of data that shows, at least in parts of the world other than Guam, that people who use continuous glucose monitoring have better outcomes. Well, maybe some of the people here say, well, that's them. What about us? We're not necessarily like them. Okay, so let's look at what happens to the folks in Guam.
Okay, and how long do you think this study will take, and how many samples or data points we need?
I think we're going to start soon. It'll probably take 6 to 8 months to complete the first study, which is the retrospective study that analyzes data from charts and medical records. So if a patient agrees to be in the study, they don't really have to do anything. They just have to give permission for their data to be analyzed. It will be de-identified so that their identity won't come out. At the end, it's not going to say we looked at Mr. Smith or Mr. Jones. We're just going to say we looked at, say, 400 or 500 people with diabetes, and here's what they had as a group. So we think that it will take a certain amount of time to identify enough people and invite them to be in the study, and they have to sign an informed consent form that they agree to have their records reviewed. So I'd say 6 to 8 months. Then we'll do the prospective study. I don't know what it'll be yet because it'll depend on what we find in the retrospective study, but we'll have a hypothesis, and then we'll test it. We'll say, okay, now if people do this, what happens? If they do this, what happens?
And Dr. Alford, once you get all this data, how will you present that to the rest of the medical community, both here and maybe even globally?
We definitely hope to do that. Definitely on the local front, there's the Guam Medical Association, so I'm sure I'll be asked to give a talk on that. So we look forward to completing the study. It's exciting.
Nestor, I didn't really introduce myself that much. I'm maybe just look like a talking head, but I'm a clinical professor of medicine at UC San Francisco. I received an award from the American Diabetes Association 2 years ago, the Physician Clinician Award, which goes to, they consider the top diabetes doctor in the world. And every year somebody else gets the award. I have almost 300 articles in PubMed, and I have an H index of 50, which relates to how many articles have been referenced, which is that close to 11,000 articles have referenced my work. I founded 2 journals that relate to diabetes technology. Currently, I'm editor of Journal of Diabetes Science and Technology. So I'm interested in technology, and I think that this series of studies will be a good application of technology. We'll be able to help people.
Thank you, Dr. Klonoff, and that really does add a lot of good context to this discussion. And I wanted to ask you also then, where would you place this particular study in the hierarchy of all the work that you've done?
Well, a lot of the work I've done has been technical. For example, how do you develop a sensor that'll make the right measurement? Another type of work I've done is when you have information, how can you analyze it? But this kind of study is not the tip. I've done a few, but this is not the typical kind of study where we actually look at real patients, especially in this context of first, we're going to do retrospective and then prospective. It's really a whole new concept. And one of the reasons why it's sort of new is it's only recent that we've had good computers that can handle this so-called big data. And also, we now have access to better genetic tests so that we can identify certain patterns of a person's health called genomics, metabolomics, genetics. These are factors that are in the blood. And it's only the last few years that this has been known. And finally, the concept of precision medicine, which I mentioned earlier, came from UC San Francisco. And that's pretty recent. That's less than 10 years old. But increasingly, people in various specialties are looking at it. So I would say that as the technology evolves, the things you can do with the technology and the questions you can ask and answer are also evolving. So I haven't done this exact study before, but I've done some similar studies and then in a way have led to the need for this. And I think that with the infrastructure that Dr. Alford is setting up and with the information that we're going to collect from the CSC, which is like a big insurance company, we'll be in a position to develop some new ways of analyzing data. We start with data, which is just a number. He had this blood test, and we put it together. And when you put data together, you get what's called information. Then you sort of have a better idea of what's going on. And then when you put information together and you analyze it, then you've got knowledge of what the problem is. So we're going to go from data to information to knowledge. And once we've got knowledge, then we'll be ready to do some things with it. And much of it is new ways of obtaining information, new ways of analyzing information.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Absolutely. Knowledge is power. I reserved a few minutes that we have left because I want to come back to what we all come back to these days, and that's the COVID pandemic. Is there anything that artificial intelligence can do with regard to the pandemic and the prevention of future pandemics or epidemics, Dr. Klonoff?
Well, one of the promising areas in treating COVID is called repurposing medications. There's some medicines that people use for things that have nothing to do with COVID, because COVID, we could say, is a recent disease. Medicines that have been around, certain kinds of antibiotics, anti-this, anti-that, that affect the body in a certain way. And many scientists are looking at the biology of cells and the COVID virus and finding certain molecules which we use for something that has nothing to do with COVID may block the COVID virus from getting into the body. It takes artificial intelligence to really analyze this information and figure out what are the medicines that are most likely to work, what kind of doses, what kind of side effects. That's where I would say artificial intelligence is most useful. And there are a few groups, including a big consortium at UCSF, that are doing this. And I think they're going to come up with some useful and surprisingly effective drugs for COVID.
Good to hear. And Dr. Alford, I'm going to give you the final word and give you an opportunity to counsel your patients, diabetic patients, on how to keep themselves safe from COVID, because I imagine that they are among the ones with those comorbidities that could be a little bit more dangerous.
Absolutely. Diabetes is such a high risk factor of poor outcomes associated with the current SARS-CoV-2 pandemic that we're having. So for all of those people out there with diabetes, the flu vaccines are in right now. Please see your healthcare provider. Get your influenza vaccine. It is separate from your COVID vaccine. Make sure you get that. We have it at all the clinics. A lot of the pharmacies also carry it. So please go in, roll up your sleeve, get the influenza vaccine. But if you have not already been vaccinated for COVID, please also get that as well. There are many different sources that you can get it from. If you have any questions, just let us know. I'm sure any healthcare provider will be happy to direct you to where you can get your COVID vaccine. But please get vaccinated.
Please get
Well said.
vaccinated with COVID vaccine. Please do it.
Thank you very much. Well said. Fascinating discussion. I appreciate your time. Dr. David Klonoff is with the AI Health Medical Advisory Board, and Dr. Erika Alford is with the American Medical Center here in Guam. Thank you both for joining us.
Thank you very much, Nestor.
Thank you. Bye-bye.
I'm Nestor Licanto. Thanks for watching, everyone. We'll see you again next week on In Full Zoom.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.